Not surprisingly, Merriam-Webster, the dictionary publisher, picked the word pandemic as its word of the year for 2020. We have been living in this pandemic, defined by Merriam-Webster as an outbreak of a disease that occurs over a wide geographic area and typically affecting a significant proportion of the population, for well over a year now. It's changed everything. Every aspect of our lives, including the way we communicate, has been completely upended. The pandemic has shown us that effective communication can literally save millions of lives, and a breakdown in communication, along with the spread of misinformation and disinformation, can cause many more to perish. As someone who teaches how to more effectively communicate, especially in a public policy context, I'm keen to better understand what helps facilitate communication and what causes it to break down. If this past year has taught us anything, it's that these breakdowns in communication can cause deeper gaps for vulnerable populations that aggravate our fight against the pandemic and can prove even more deadly. But communication in general is hard. It's not easy. We suffer from failed marriages, lost businesses, election defeats, and broken friendships when we are not capable of effectively communicating our messages to our intended and sometimes unintended audiences and markets. But add the challenges of communicating during a global pandemic with populations learning on the fly how to combat the virus, the likelihood of communication breaking down or being swept up in the storm of an infodemic is high. The World Health Organization called the infodemic one of the biggest challenges in fighting this pandemic. As defined by the WHO, an infodemic is too much information, including false or misleading information in digital and physical environments during a disease outbreak. It causes confusion and risk-taking behaviors that can harm health. It also leads to mistrust in health authorities and undermines the public health response. The OECD issued a report noting with such an onslaught of conflicting information competing for audiences' finite attention spans, especially young audiences, that increasing the volume of official information is not enough, nor is it necessarily effective. The content needs to be more compelling and delivered via various preferred channels, including social media. The messaging also needs to take into consideration their behavioral and psychological biases. Since the outbreak of the pandemic, we've seen how failed public messages can aggravate a country's COVID-19 response. For example, let's take a look at the issue of wearing masks in the United States. Even though the recognized authorities were issuing recommendations or guidelines, even mandates, these messages were being ignored or outright disobeyed by certain segments of the population. We saw many incidents in the US of people decrying that their freedom was being infringed upon because they were being mandated to wear masks in public places or businesses. It also had the misfortune of becoming politicized. So when people saw their community leaders questioning the efficacy of wearing a mask to prevent the spread of the virus, they were encouraged further to not comply. It also didn't help that the recognized authority on the matter, the WHO and US public health authorities, flip-flopped on the matter, advising the public at the onset of the pandemic not to wear masks, and then later on advising them to. The lack of consistency and unity from our leaders in our messaging leads to a loss of credibility, crippling the effectiveness of the message and the likelihood of compliance. Meanwhile, on the other side of the world, we have New Zealand's Prime Minister, Jacinda Ardern, who has been praised for her effective communication skills in helping her country ward off COVID-19. The Atlantic described her leadership style as being focused on empathy, and her messages as being clear, consistent, and somehow simultaneously sobering and soothing. Gary Neusner, a former chief of the FBI Crisis Negotiation Unit and author of Stalling for Time, explains that using science or the law or politics won't stop those who don't intend to comply to these regulations. We need to influence their behavior, and we do so by creating a respectful and trusting relationship. And this is done by staying calm, patient, and understanding and acknowledging their points of view, and asking them to consider thinking a little differently. In other words, by being empathetic. We're fighting an uphill battle when it comes to this pandemic and the infodemic that thwarts our progress and instigates our communication breakdowns. We must continue to raise awareness of the deadly nature of misinformation that fuels an infodemic. To combat misinformation, we need to engage with those who are already skeptical and address their existing perceptions, reinforce critical thinking skills so our students can discern reliable sources among the growing prevalence of information sources with blurred origins and intentions. I'm relieved to see a growing level of coordinated efforts among multilateral organizations and advocacy groups to fight against an infodemic, which some experts claim to be deadlier than the actual pandemic. To ensure more effective communication during a time of crisis and in general, remember to keep your messages consistent, clear, and credible. When we flip-flop on our messaging, we lose our credibility and inevitably our audience's trust. Build a rapport with your audience so there is trust and understanding. Building public trust increases the likelihood of compliance with public health recommendations. Express empathy to help open those channels of communication with groups who are likely to disagree or not comply. Understanding who they are and why they are predisposed to certain beliefs will help tailor your message to better resonate with them. Facts, figures, and evidence can only do so much, as we've seen not only since this pandemic, but also as we continue to fight climate change. The stakes are high, so we need to do what we can to assure that what we say, who says it, and how it's delivered is effective in terms of reaching people and motivating them to act and change their behavior for the better. Now it can be literally the matter of life or death. This past year has given us many lessons on how we can do better going forward. We all need to do our part in reimagining our respective worlds to a place where words like infodemic and pandemic can remain in our dictionaries but listed as obsolete and no longer commonly used. Thank you.